Hello and welcome to this episode of our Health Nuggets. My name is Aida Munzati, and on today's show we are going to look at epilepsy being International Epilepsy Day. That's why I'm in purple, just to be in solidarity with people living with epilepsy. So we're going to look at different aspects of our epilepsy, from the diagnosis, the causes, the treatment, just to make epilepsy a health priority.
You could say in Kenya about 2% of the Kenyans could be living with epilepsy, and that is what we are translating to be 1 million. Treatment gap is those people with epilepsy that are not receiving appropriate treatment. So it's about 80%. So meaning that only 20% are not receiving appropriate treatment, either because they don't believe that the treatments can be able to assist them control the seizures, or because they have other barriers that are making them not access treatment.
Well, so those are epilepsy statistics, not just in Kenya, but worldwide as well. And now to confirm these statistics and just to delve further into this conversation, even as we mark International Epilepsy Day, I'm being joined by the chairman of the National Epilepsy Coordination Committee, that is Dr. Simon Kariuki, as well as Sam Kivinda, who is a person living with epilepsy, just to share his experience as well as better awareness on this day. Karibuni sana to the set, gentlemen.
Yes, thank you.
So thank you so much for your time and even for the opportunity just for us to create awareness and more awareness about epilepsy. And starting with you, Dr. how does the numbers look like of epilepsy in Kenya and also worldwide?
Yeah, so epilepsy is not only a serious condition, but it's also a very common condition, and that is worldwide. We know that around 70 million people live with epilepsy, and here in Kenya we estimate that around 1 million people live with epilepsy, and that is based on the prevalence studies that have been done here, which shows that 20 in every 1,000 people may be having epilepsy. So if you apply that to the population in Kenya of around 50 million people, then that is going to be at least 1 million. But I think that is when you count the numbers, but there is also these new cases which occur every year, because it is those new cases which accumulate over time, and then they give you the total number of cases of people with epilepsy, and that is what we call incidence, and in Kenya it's around 70 per 100,000 people. But the numbers that we have so far really do not represent the true picture, and we think that the numbers could even be greater, because previously we've been focusing on convulsive epilepsies, that is epilepsies which have some physical manifestations, but there are other forms of epilepsy which can present in ways that you cannot be able to see, e.g., perturbations in concentration, some behavioral manifestations, sometimes even a blinking of the eye, especially in the case of the absences. So if we were to do studies that were going to include those types of epilepsies, I believe the numbers would even be greater.
How about worldwide?
So in the world, the numbers are around 70 million people. But I think if you compare high-income countries and low-income countries where we are in Kenya, we think that our numbers are 3 times more. So when I'm talking about 20 per 1,000 population in Kenya, if you go to a high-income country, so like Great Britain, for example, you'll find that the prevalence is allowed 4.5, all 5 per 1,000 people. So you can see then in that case that our prevalence is 3 or 4 times greater, and that is related to so many reasons, including some risk factors that usually increase the risk for epilepsy.
Okay, before us looking at what exactly epilepsy is, because you might be assuming that people know what epilepsy is, let's just talk to Sam, who you're a person with a lived experience of epilepsy. When were you diagnosed and how has the journey been to where you are today?
It's been 30 years, so 1992 if I'm not wrong.
So you were diagnosed when you were how old?
I was just about to do my standard 8. So how old is someone on the
Around 13, 14 years.
Yeah, around there. Yeah.
And how has it been, maybe comparing then and now, how is it? Has the stigma reduced? Did you face stigma or?
Given the period of time that I've lived with it, I'd tell you I've been a very lucky person because of what I have seen and encountered. In comparison, I won't tell you that I've really been stigmatized over the years. My parents took me to see a doctor. I was diagnosed. MRIs were done, the full tests, and I was given drugs. And initially, I wasn't used to it, so you skip a day or forget and something like that. And because it's just starting off, then the seizures are more severe. But over time, since because of also how my lifestyle changes, you need to make some here there. It's more or less managed now. The last time I got a seizure was probably mid last year. Yeah.
And being young and being told that you have epilepsy, is it something that you accepted immediately, or was there a struggle? Did you first of all understand what epilepsy was?
I was in standard 8, and I was just about to do my KCP. I remember the doctor mentioned the stresses and strains of preparing for the exam. Yeah, that's what triggered it off. Then my focus was on the exam. Then this thing comes along and sweeps you off. It was a struggle, but my parents, family, they helped me out. And then also, I'd have to recognize my community, friends at school, and then close friends weren't like, this thing, what is it? Stay away from me. No, they weren't that way. So, like I said, I've generally been very lucky. Yeah.
So, Dr. maybe just tell us what exactly epilepsy is, and in your previous response, you mentioned of the different types. Maybe you can just tell us what epilepsy is and in what forms does it come?
Yeah, so epilepsy is actually a brain disorder. So I think everything that can affect the brain, we say, can lead to epilepsy. And what happens is there is excessive activity of the neurons, because in the brain you have neurons communicating with each other, and there are those which are supposed to be excitatory, that is supporting some action, and then there are those neurons which are supposed to be inhibitory, trying to oppose some activity. So when you don't have a very good balance between that, because maybe something went wrong, you got an infection or you got an injury, and then the neurons that are responsible in initiating some activities continues firing unchecked. So in that case, then you start developing what we call seizures. So seizures themselves are not epilepsy, because you can have different types of seizures. You can have seizures because of infections or because of having fever, and those ones we call acute seizures or febrile seizures. But you can also have other seizures which do not meet the threshold for epilepsy. So they are not caused by fever, but because you've not experienced them in more than 2 in number, and they are not 24 hours apart, then you either call them single unprovoked seizure. And in that case, that's not epilepsy. So it is until when you have seizures that are not related to any immediate underlying condition as at that particular time, happening 24 hours apart, 2 of them, then in that case you'll be said to be having epilepsy. So in some instances, even if you get the other types of seizures in the long run, so they might increase the risk for developing the subsequent and provoked seizures, then you have epilepsy. So they usually have different way of manifestation, and this mostly depends on the area of the brain which is affected. So there is commonly the seizures that we call the focal seizures, especially the ones that come from the temporal lobe side here. So they tend to manifest a lot with some sensations. So like somebody will have like hallucinations, you are seeing things which are not there, you might even be hearing voices. And we have so many people, when they are having the seizure, they start by saying that they are having an epigastric feeling. It is because of that particular part of the brain that is being affected. So if the part of the brain affected has to do with motor activity, for example, the hand, then you'll start seeing that hand convulsing. And sometimes it can start in one part of the brain and then spread to the other hemisphere, and then you have the entire brain affected, and that is what leads to the common types of epilepsies that we see. And that's the generalized tonic-clonic seizures, where you have somebody falling on the ground, and then they are thrusting their feet, they have lost their consciousness. Sometimes they will even have some foam coming out of the mouth, and then they will also be very tired immediately that event happens. So whenever we talk about epilepsy, it is the generalized tonic-clonic one that takes people to the ground. That majority of the people can be able to identify. So what they can't identify is the other manifestations, which I said can even be behavioral changes, and we've seen some of them actually being presented to the psychiatric clinics where they think that it is a mental health situation, but when they come or are referred for EEG, we are able to identify that there is actually some firing in the brain, and then a diagnosis for epilepsy.
So Sam, you just mentioned that the last time you had a seizure was sometime last year. So what type of seizure do you experience, or what types of seizures are you experiencing?
Mine is, I know it's from the side. When I was being diagnosed, I had tuberculosis when I was a child. Went through it, took drugs, it got finished. But then now it left a scar on the right side of my brain. That is what the doctor explained it as. And when there was what he said were the stresses and strains of preparing for the exams, that's what triggered it. And I think the focal, you call them?
Yeah, focal seizures.
Focal seizures, yes. Yeah, for the side, right side of the brain. That I remember.
Like, can you tell when you're about to have a seizure? Sometimes
yes, sometimes no. They call them auras. There's a feeling you get. You can't put it into words. You know it's coming, and I think that's the worst thing about it. There's nothing you can do. Sometimes you just get the aura, but you don't get the seizure. But yeah, it's like and sometimes the seizure just comes by itself. So it's not one thing will necessarily lead to the other. But it's like telling you I'm on my way.
Okay. So what do you do when you experience such? When you're working, do you sit down? When you're doing an activity, do you stop doing that particular activity?
Sometimes it's like really immediate. It's like you get the feeling and then it happens. So And then it's not like you're fully aware. You know you're having it, but then now stopping and then thinking to yourself, okay, I need to sit down and stop moving around or something like that. That doesn't really occur to you at that moment. So it happens.
Yeah. So you are a DJ and you are a writer.
Yeah.
Has that episode occurred to you maybe when you're in the middle of the work and you're surrounded by people? How was the experience like? Because you said it's 30 years. I want to understand that there has to be such an experience within the 30 years.
There was one time I was going, it was an interview. I needed to do some writing for a client. So we're going to sit down. He gives me the breakdown of what he exactly needs from me. And that, the previous day, I had the concurrent seizures, the ones that come one after the other. And I couldn't make it. So I had to, and then sometimes, also telling someone, and I can't call you and tell you, sorry, I can't, yeah. My partner, I gave my partner my phone. She's the one who wrote the text. And I can't tell the other person, I'm having seizures. Yeah, I'm having seizures. Can we reschedule? We had rescheduled once already. So now that one just went by that way. As a DJ, yeah, a couple of times it just went silent. Because
And it was an event.
it was in a club.
That is quite an experience. And now, Daktari, Sam has shared a very important element that is to do with the causes of epilepsy. Maybe you can just share to us, Daktari, what are the causes of epilepsy and at what point in someone's life do they happen? Is it immediately after birth or during birth?
Yeah, so I think Sam has talked about two very important things. So he's been able to separate the causes from the triggers, and that is very important. So a cause is what actually initiates the process of a person developing epilepsy. Either it could be something that caused a damage, or it could be that vulnerability that you are born with, because some people usually have some genetic predisposition, and you'll find that epilepsy is running in the families. Or maybe in the place where they are staying, there are so many risk factors within that area, and therefore many members of the family will be developing the epilepsy. But from the work that we've done, we've realized that some of the most important causes actually start way before even a child is born, during pregnancy. For example, having a difficult pregnancy, maybe a mother going into what we call eclampsia, and so on and so forth. And then during birth, and during birth is the most important period, because if you have like a child not getting sufficient oxygen, in a case where you can tell from delayed crying and delayed breastfeeding and so on and so forth, then that low oxygen in the brain is going to leave some damage behind. So that is another way. And then the other one is, of course, infections. And infections can affect at the different stages of life. So you can have infections in childhood, especially malaria and the others. But because many people tend to gain immunity against malaria when they are growing up, so you find that other forms of infections become very important in adulthood. So like parasitic infections. So some of them that we've been identifying recently is actually on Coxsackie volvulus, and fortunately we don't have a lot of it here in Kenya, but in some parts of Tanzania where we are working, it's very common, and it can actually lead to epilepsy and other things like bacterial meningitis, encephalitis due to viral infections. So all those are going to cause epilepsy. Then Another important cause is head injury. So we see that quite a lot, especially when you are involved in a road traffic accident, which is very important from a public point of view because of an increasing number of motorcycles on our roads. But we also have so many other chronic conditions that can also lead to someone developing epilepsy. For example, stroke, because stroke has a direct impact in the brain, and it's usually also very much related to hypertension and also to diabetes. So we can also consider those three groups of chronic conditions as very high risk people, and they should be cautioned about it, especially if within the family there is somebody who has ever experienced the condition. So just wanted to touch briefly about the trigger, because I like the way Sam said that he had experienced a tuberculoma before, which is caused by TB, some years back. And then later on, when he was in class 8, so he got a trigger. So in that case, the trigger was stress. So this is somebody already who sustained an injury, but then because of another hypothesis we call like double hit hypothesis, like you need something else to come and affect you so that the risk can be increased. That stress is actually that brought out the epilepsy, but it is actually not the one that started it. And you can have so many other things that can be triggers, which we need to advise people against. For example, flickering light. Discos, I've heard some say he works in a disco. Actually, that is one of the risk factors because of the light, and it can make some people experience that. Then you can also have like excessive alcohol consumption as well, so that can also increase that risk of experiencing seizures, and also some changes in the blood, like we call them electrolytes. So if you don't have like good balance of those potassiums and the calciums and also the blood glucose level, then you are at a very increased risk. So in that case, when you are treating someone, so you make them understand about the causes, but you also educate them to stay away from the triggers and maybe to manage their stress.
Sam, having shared your experience,
Yeah.
and you've shared that you've also lost opportunities, due to epilepsy. Have you experienced stigma and discrimination maybe from the society?
If I was to give you a one-word answer, I'd tell you no. Yeah. My life has been more or less straightforward. One, my support system has been very good, from my parents, the people that I call friends. They have been a community that is helpful. People maybe who don't know me personally, maybe question. But yeah, like I said, if I was to give you a one-word answer, stigma, no. Yeah.
Okay. So, Daktari, in terms of NECC creating awareness and even informing the public of what epilepsy is, I mean, Simon was diagnosed with epilepsy, that is 30 years back. How can you compare then and now in terms of stigmatizing people living with epilepsy and even discriminating them?
Yeah, so I will actually start from the fact that every time we talk about stigma, so obviously putting labels on people, discriminating people living with epilepsy. So we always tend to look at it from the point of others, stigmatizing or looking down on the person. But there are usually two other very important stigmas. So the one that you have other people placing labels on you and then also stigmatizing you is felt stigma, because you feel it. But there is also another serious one that we want to unravel, and that is the self or enacted stigma. that is where you feel you are not worthy because of the condition that you are living with, because of the fact that you've been diagnosed with epilepsy. And I think that's usually very, very difficult to handle. So when you are doing interventions, you need to target the community, the society, which is actually perpetuating the felt stigma, but you really also need to focus on the individual to try to encourage them that they can actually live a normal life just like any other person. And I really quite like the positive attitude that Sam has. So he says for him, he's had a very supportive family and an environment, and the condition he has hasn't really deterred him much from doing his day-to-day activities. Then there is another important stigma we call institutional stigma. And institutional stigma, again, is also very difficult to break because it's in the places of work, it's in organizations, and so on and so forth. So when you hear that people with epilepsy are being denied equal opportunities, that they are not getting employment, it is because there is stigma in the institutions. So at the NECC, our aim is actually to be able to do interventions that are going to target all those three levels. So interaction with the patient. We also interact with the members of the society through the radio caravans. In terms of the patient themselves, we even have some of them as part of NEC as members, and they're also playing very active roles. And that one really helps other people living with epilepsy actually to accept their conditions. So we are also beginning recently to increase now our reach to the institutions, so focusing on schools, primary schools, because I know that's where there is very rampant stigma, because there is also, those people are young and then they are not quite very knowledgeable, and also in institutions like prisons. So we are quite very keen about that. So what we do to address the issue of awareness is we go to the community. So we just do what we call sensitization programs. So where we speak to the persons directly and to the members of the society directly. But we are also very keen on training, because when you train people, what we realized is even healthcare workers also have some negative attitudes towards people with epilepsy, and unless you train them, not only in dispelling the beliefs that they have, but also on understanding the conditions better, I think they are going to start now looking at them positively and making them feel much more welcome in the settings where they are. And again, also in involving the government, I usually like touching on them, because you realize that they have not given epilepsy as serious attention as they have done to many other infectious conditions. Yet those infectious conditions, including even HIV and malaria and TB, which they give a lot of emphasis, are the ones that usually lead to the condition. So we need to create awareness there as well, because that awareness is what is going to lead to increased investment in epilepsy care.
Maybe even probably reducing the numbers of new epilepsy diagnoses.
Yes, absolutely. So to reduce the number of new cases of epilepsy, so we need to target more about translation of evidence into practice, because there is usually some gap there. So you know very well, if I have an intervention to control malaria, then it's going to prevent development of epilepsy. But what do we usually do? So I think at the moment we only focus on managing people when they have the acute infection of malaria, but then we don't have interventions which are preventative.
All right, so Sam, as we mark International Epilepsy Day, what are your last words, or what would you want the public to know about epilepsy?
Awareness to me is an ongoing thing. It's not that I'll come to you today and tell you about epilepsy, and then we'll wait another year and then do it again. If it's a continuous thing, that every chance you get, you mention, even if it's, by the way, did you know epilepsy is a manageable condition? Or there's ways in which you can change your lifestyle to reduce how probably you might develop epilepsy. Here, one word here, one word there, but then it's continual. I think that's the most important thing for me. Previously, I used to tell myself, I don't really think about me having epilepsy. It's one of those things. It comes to mind when I have to go and get my drugs, and when I get a seizure. That's it. The other times, it's not there. But it has to be, because that's the only way I can also let someone else know. I'm not going to be in your face, but just let you know, but epilepsy is manageable. And I think if it's continual that way, then it's how the feedback will be better, because more people then will get to know about it and then do something. And it's not an event. I hope you get my meaning. Yeah, an event is today, it ends, everyone continues living their lives.
Daktari, your words as we mark Epilepsy Awareness Day?
Yeah, so I think there are sort of like 3 or 4 aspects that I would consider very important as we mark the International Epilepsy Day. So the first one, which you've already touched, is on creating awareness about epilepsy, touching on the causes of epilepsy, the impact of epilepsy on the individual, and targeting different levels of people, the patient, the society, and also the stakeholders, including the government, so that they can invest more in epilepsy care. The second aspect, which is a serious issue that we are facing, and you heard today when we were giving our statement, is the lack of evidence. So epilepsy is actually there in the communities. We suspect that, but because of stigma, many people stay away, and therefore they are never included into the statistics of the day. And when you are engaging the governments, they really want to hear about the numbers. So if we can do quite a lot, even at the county level, to just document those cases and then show them to the authorities, then they are going to see the need as to why they should be able to come up with a budget for that. The other one, like I said when I was talking about interventions, is collaboration. And it is actually the one that has informed the World Health Assembly, the current one, 78.10, which is actually called the Intersectoral Global Action Plan. So you bring all partners together, just like the way we do at NECC, government partners, pharmaceutical companies, psychologists, sociologists, and the media, because of media advocacy. And then working together, we can be able to highlight all those problems that I have mentioned associated with epilepsy, including the last one, which is very important, on drugs, because seizure medication are very important, and we just need to make sure that they are taking safe drugs, they are taking appropriate drugs, and that includes even the government honoring the commitment that they said that they will not only provide the old generation anti-seizure medication, but they are also going to make the new generation anti-seizure medication available, as already indicated in the essential drug list from the Ministry of Health.
Well, that was Dr. Simon Kariuki, the Chair, National Epilepsy Coordination Committee, as well as Sam Kiwinda, who is a person with lived experience of epilepsy. And I hope that from the conversation that we've had, you've been able to learn 1 or 2 things about epilepsy. And together we are going to continue creating awareness about epilepsy even beyond today, which is International Epilepsy Day. I've been your host, Ida Munzati. Until next time, your health matters.